Welcome to the press briefing today. With us, Dr. Albert Lau, Principal Medical and Health Officer from the Center for Health Protection, and Dr. Lau Kai-yin, Chief Manager, Hospital Authority. Dr. Lau and Dr. Lau will brief us on the cases and the situation at the AHA. Dr. Lau, please. Good afternoon. I would now report the latest situation on COVID-19 from June the 27th. Yesterday, there were 1,533 locally acquired cases, including 603 cases confirmed through PCR tests, 930 cases tested positive through RAT results, and the results were verified by PCR tests. Yesterday, there were 152 imported cases, of which 119 were confirmed through PCR tests, 33 tested positive through RATs. 1.228 million positive cases. We had one new fatality yesterday. Since the fifth wave started, Hong Kong recorded 9,186 deaths. I would now invite Dr. Lau to brief us on the situation at the hospitals. 645 COVID-19 patients are currently staying in hospitals. 93 were new patients. Of patients isolated, 202 are staying in isolation wards in public hospitals. 18 are staying in Tier 2 hospital beds. 182 are staying in the North Lantau Hospital, Hong Kong Infection Control Center. 92 were new COVID patients. Yesterday, 3 more patients were reported to be in critical condition and 1 in serious condition. Of the hospitalized patients, 13 are in critical condition, 15 in serious condition. 3 of the patients in critical condition are staying in ICU. Yesterday, there was 1 new reported case involving the death of an 88-year-old female. She was a resident from a residential home. She received 2 doses of a COVID-19 vaccine. She had a history of chronic diseases such as hypertension and diabetes, and she had stomach intubation as well. On the 25th of June, she was admitted to hospital. She was undergoing quarantine at the Asia World Expo, and she tested positive via RAT and she had fever. Upon admission, her condition deteriorated rapidly and she passed away yesterday. Of the recent cases, their conditions were relatively mild and stable, even though the number of hospitalized patients went up slightly compared with a few weeks ago. Patients admitted to isolation facilities were generally in less serious conditions, and we did not see a surge in the number of patients in critical or serious condition. As a whole, the situation is stable. Dr. Lau, please. I'd like to brief you on the cases yesterday. Of the 152 imported cases, 86 were identified at the airport temporary specimen collection facility. 54 tested positive at quarantine hotels. For the remaining 12 cases, they tested positive after they completed quarantine. There were no new cases from residential homes involving staff or residents. As for schools, this morning, we received 202 reports of positive cases involving 172 schools. These included 47 kindergartens or childcare centers, 69 primary schools, and 56 secondary schools. No special schools were involved. Over the past 7 days, for the schools that accumulated 2 cases or above, there were 79 schools. Of the cases we received this morning, we found that in 3 of the schools, there could be transmission at certain classes, and we recommend suspension for a week. The Sha Tin Loi Ming Choi Primary School Class 3D, there were 4 cases. The class had 34 students. Another school was the Qing Yi Catholic Kindergarten. in a morning class of the 24 students, there were 2 positive cases, and the teachers from that class also tested positive. Another was the Ling Liang kindergarten in Manshan, class 2A. 3 students out of 30 tested positive, and the teacher also tested positive. In terms of genome sequencing, the public health laboratory found 28 cases of suspected BA.2.12.2 cases, including cases that were epidemiologically linked with prior cases. 11 cases were untraceable, and 6 patients were family members of these cases. These 11 patients lived in Block 8 Taifeng, Bedford Gardens, Blocks L, Tinjun in Taipo, Tassin House in Tumun, Tipling House of Wutip Estate in Tumun, Manchak House in Hengman Estate, Hei Tong Court in Shaokei Wan. This household had 5 positive cases. Yuan Building, Sanchun Road, May Park House, Shekimei Estate. This household had 2 positive cases. Another case involved Mountain Estate in Tumun and Peck Hall Building, Block A, 105 Peck Hall Street. The household had 2 positive cases. Another 11 cases were epidemiologically linked with prior cases, of which 9 were related to the Victoria Harbour restaurant cluster. For the Victoria Harbour cluster, there was 1 new case today who was a diner. It was a 70-year-old male. The PCR test on the 24th came back positive. There were a total of 42 diners from that restaurant that night who tested positive. And we saw possible transmission within 2 buildings, and these 2 buildings involved those who visited the restaurant, Kinon Estate, Shanking Kinon House, and there were 3 new cases across 2 families. Another lived in Hengwai House of Tai Heng Estate. It was a new positive case, and another resident who lived in same floor were related to the restaurant cluster. Another 4 cases involved the Choi Yun restaurant in Moko, Mongkok, and we found that this case could be related to the Victoria Harbour cluster as well. In the Victoria Harbour restaurant cluster, there was an earlier positive case who patronized Choi Yun restaurant at about 12:30 p.m. on the 19th of June. He visited with another family member, and subsequently they both tested positive. These 2 patients visited this restaurant during the infectious period, and on the 24th, we issued a compulsory testing notice, and later we identified 4 more cases who also visited the restaurant on June the 19th from around 12:30 to 1 p.m., involving 3 diners across 2 tables, as well as 1 waiter. The remaining 2 cases were not related to Victoria Harbour restaurant, but were linked epidemiologically to earlier cases. 1 lived in Block P, Hoi Yi Garden. Another lived in Pullman Street, number 2, Hoi Fong Center, and there were prior cases from the same floor of that building. Apart from BA.2.12.2, the public health laboratory identified 16 suspected cases with the BA.4 or .5 subvariants, of which 12 were imported cases. The remaining 4 cases were locally acquired cases, including 1 case involving a 52-year-old female who received 3 doses. She lived in Shuntin Estate. and she was responsible for cargo cleansing at the airport. She last worked on the 25th of June. She started showing symptoms the same day, and on the 25th, the PCR test result was positive. The CT value was about 35. Since she worked at the airport, she was regularly tested, and the PCR tests on earlier days were all negative, so she could be infected at the workplace. Another case was a 37-year-old male who received 3 doses. He lived in Kam Ying Court, Block A, Kam Yi Court. He worked at an office in Xunwan, and he last went to work on 24th, and the RT positive test on the same day was positive. A family member tested positive on the 27th.
The third case was a 57-year-old female with 3 shots. She lived in Hoiting Road, Hoi Boon Court. She actually worked at a daycare center at Olympian Station, and her work mainly involved actually dealing with food in the kitchen. Her last day of work was June 24th. She had the symptoms the following day, and her PCR test tested positive. We recommended that the daycare center should suspend its services, and all staff are required to go for PCR test to ensure that other staff are not infected. The last case involved a 38-year-old male who had 3 shots, who lived in Shu Sai Wan Estate, Shui Long House. He works in an industrial complex in Kowloon Bay, and he's doing clerical work, and he tested positive, and his was an untraceable case. And besides the Monshan case, for the other 3 cases, the family members of them had no symptoms. That's the end of my report. Of all the recovered patients, 71 patients have been recovered in the past day, and 64 of them have been discharged from hospital. In the 5th wave, so far, we've got 51,733 patients who have recovered, and of them, 51,418 patients have been discharged. Since early 2020, we've got 64,153 patients who have been recovered, and 63,798 of them have been discharged. Right now, so far, we have not recorded any case of patient who tested positive during screening after being admitted into hospital. Among staff, 24,234 have been infected. Of them, 23,961 of them have reported back to their duty. That's the end of my briefing today. So now it's time for questioning. Please raise your hands, and before you ask a question, please let us know which media outlet you're from. The first one, the lady in white. From now, I want to ask about the situation in relation to Victoria Harbour Restaurant. Just now, Dr. Al said Victoria Harbour led to clusters in various places. Have you discovered more clusters now related to Victoria Harbour? What do you think of the risk there? And also, yesterday you said that there was actually inadequate change of air in the restaurant. And there is report that this morning, however, the restaurant was in business. So what is your criterion for asking the restaurant to be closed temporarily? If there is not adequate input of fresh air, would that actually mean that the restaurant should suspend its services? Is there any room for improvement in your criterion? How would you assess the risk of triggering more clusters? And also for BA4 found in some local cases. Are those 4 related cases untraceable? What do you think of the the approach of July 1st? A number of celebrations are being planned. What is your assessment of the risk of an outbreak? And also, lastly, experts have said that in residential care homes for the elderly, the quarantine arrangements there, should there be more outbreaks in the care homes, is there any chance for quarantine, on-site quarantine? Are you prepared, for example, the HA, would you be prepared to have outreach teams to provide support at the care homes? Should there be any outbreak? Thank you for your question. The Victoria Harbour Restaurant cluster, it happened began on the June 16th. And so more than 2 weeks, about 2 weeks have passed since then, and we have issued compulsory testing notice. And through the vaccine pass records, we have obtained the list of patrons at the restaurant. And we've got 42 cases related to the restaurant so far. And we believe that most most customers at the restaurant have undergone tests. There are about 270 customers at the restaurant there, and about 40 of them were infected afterwards. The first cases were identified on June 27. So on that night, of the customers who were there, I think there was someone who spread the virus, resulting in the cluster. And we've also carried out an environmental investigation. We didn't find any environmental samples that tested positive, but the CNEE found that the ventilation system at the restaurant found that there's not enough supply of fresh air, and the change of air on an hourly basis was also inadequate. Should that be the case on that particular night? So there's a chance that should there be an infected person on the at the venue, so that could be short distance transmission at the premises. And we found that to us it seems that the people infected could have been exposed to the virus within short distances. And also as a result of our investigation, as we said, at the New Century Place in Mong Kok J Garden Restaurant there appeared to be a small-scale transmission, which is related to Victoria Harbour. But we need to do more genome analysis first and find the genome sequencing first to come to a conclusion. And also in the full-time care home, there were 2 staff who had been to Victoria Harbour Restaurant. So we won't rule out the possibility that the 2 staff at the residential care home might have brought to the care home, resulting in an outbreak at the home. So we need to wait for the outcome of the genome sequencing first. Our initial investigation found that the 3 clusters so far that I mentioned are related. For restaurants, should there be an outbreak, if there is a large-scale outbreak, then the Center for Health Protection will carry out an epidemiological study and also join hands with the Food and Environmental Hygiene Department and CEDD to investigate the environment of the restaurant concerned and issue compulsory testing notice. If we found that there are environmental factors like ventilation, supply of fresh air issues, then the Food and Environmental Hygiene Department would ask the restaurant concerned to make improvement and suspend its business until the substandard situations are rectified. And we would ensure that all the customers present at the restaurant concerned when there was an outbreak be required to undertake a test, and all the staff and the customers have to test negative before the restaurant can resume business. I believe that the Food and Environmental Hygiene Department will follow up on the closure of the restaurant. And of the 4 cases in relation to BA4, at least 3 are not traceable. And they had not had any epidemiological link with imported cases. So I believe that they may have been infected locally. And there's also 1 case involving a cleaner at the airport. Even though it's an untraceable case, but because the person works at the airport and the person concerned could, because of work, have contact with inbound tourists or imported cases. So this case in particular might be related to import cases, but related to which particular case, we still need to wait for the outcome of the genome sequencing before we can come to any conclusion. And as for the quarantine arrangement at care homes, right now, if there are cases found in care homes, and so far they are at a low level in relation to the cases found, and we have adequate quarantine and isolation facilities to cope. And since care homes are high risk and key premises, and the residents at the care homes, they tend to be in concentrated areas, And so the air ventilation may not be so good at many of the care homes. So we need to make sure that once there's cases of infection found, we need to move the cases concerned away from the care home in a controlled environment that is to be isolated. And for residents who were exposed to any risk and at risk of being infected, should they remain in the care home, sometimes the residents may not wear the mask properly. Then for these individuals, if once they are classified as close contacts, we will arrange for them to move to a more ideal environment for quarantine, and where there are also people looking after them and monitoring the situation. Should they develop any symptoms or turn out to be infected, they could be treated immediately. So any supplement from Dr. Lau?
佢第五波初頭嘅
You might remember that at the start of the fifth wave, we saw that many residents from residential care homes were not swiftly removed, including patients and close contacts, and that led to mass outbreaks from the residential homes. Under the Labor and Welfare Bureau, there is a working group consisting of the DH and other government departments. And later, we agree that if there were positive cases from residential homes, the patients should be removed as soon as possible to avoid infecting other residents. Likewise, for close contacts, they would be subject to a much greater risk of infection. So if they do test positive, there is a less likelihood they would infect other residents. And in light of the above principles, we have sought to relocate the cases to respite or holding centers or other facilities such as the Asia World Expo. And for those who had to be hospitalized, we would make the relevant arrangements. And the goal is to prevent the need to for these patients to stay at the residential homes for a long time. If support from our support outreach teams is needed, we can certainly do that. From our experience, we saw that our geriatric outreach teams can get in touch with the residential care homes as soon as possible and provide advice or support. If time is sufficient, we might be able to prescribe oral antivirals. If patients could be transferred to holding centers for quarantine as soon as possible, at the holding centers, we have members of the HA there who can provide support. If patients have any needs for medical attention or drugs, there would be doctors at these facilities. And if needed, the patients could be transferred to public hospitals for follow-up. Next question, we will take a question in English.
From RTHK. So what is the risk of infections of dining in the Tuen Mun restaurants where the ventilation is not up to standard for now? And does it warrant a full closure there? And for the Mongkok restaurant linking to the Tuen Mun cluster, what is the risk of spreading there? And could it lead to more clusters stemming from the Tuen Mun outbreak? And also maybe for Dr. Lau, because a specialist said that the elderly are feeling very uncomfortable to be quarantined at the Asia World Expo. So would the authorities do anything on that or consider quarantining some of them on site, and why? Thank you.
Thank you for your question. For the outbreaks in the Tuen Mun restaurant, we have carried out epidemiological investigation and also issued a compulsory testing notice to the customer who had patronized this restaurant on the 16th of June. And so far, we have identified 42 customers affected, and the remaining customers were tested negative already, the majority of them, and also all the staff were tested negative. So we consider that the outbreak has ended. But however, during our epidemiological investigation, we have identified some secondary cases, mainly including some cases with transmission in the same building, as well as unsuspected transmission in an elderly home, the full-time OH home, and also another small scale outbreak in another restaurant, which might be related to the Twin Moon restaurant. For the restaurant in the new in Mong Kok, we have already issued a compulsory testing notice on the 24th of June, because two customers of BA.2.12.1 who was related to the Twin Moon restaurant had patronized the restaurant in Mong Kok, and so far we have identified 4 cases. We will follow up the remaining customers who had patronized this restaurant on the 19th of June to see if there were further cases. And also we have informed the FEHD to carry out inspection on the ventilation and also this restaurant to see if there is any irregularities.
As you may remember, there are many residents being left in the OH home for quarantine as well as isolation during the early 5th wave. According to this experience, there's a task force under the Labor and Welfare Bureau, and there are Department of Health, other departments in this task force. We have agreed that we have to remove the confirmed cases as well as the close contact out of the OH home as soon as possible, in order to avoid further spread of the virus inside the OH home. So this measures aims to reduce the chance of transmissions of the virus inside the OH home, as well as we don't want the residents to be the source of the infection. If the patients has been was admitted to the quarantine center as well as in the holding center for isolation, there's a medical post there. We can provide the medical services, including the prescriptions of the oral antivirals to the patients as soon as possible, in order to prevent the further deterioration as well as the death of the patients. So these measures are good to the patients themselves as well as to the residents who are still inside the OH home.
Next question, please. The lady in black on the second to last row. This is the Hong Kong Economic Times. For the Victoria Harbour restaurant, there are a total of 42 cases. How many tables were involved? You said the EMSD made an inspection last Saturday, and yesterday the fresh air change was found to be inadequate, but they were still operating today. Why was that the case? As for Jade Garden in Moco, can you tell us about the gender and age, and would that patron be a super spreader? How far was the separation between the tables? Did that waiter ever serve the patients? How many diners were there at that moment? And would the EMSD conduct inspections on the fresh air change or ventilation, or would the restaurant be ordered to suspend operation till the results are available? For the 67-year-old female, she was responsible for handling food. Did she wear a face mask at that time? And she served food for, or she processed food for the elderly. So would the elderly people have to be quarantined as well? As for the outbreak at Victoria Harbour restaurant, 42 diners were involved. I have no information on the number of tables they occupied. Some of them were a cluster. For instance, there were families of 2 or 3 who tested positive later. So we are going to look at their distribution. According to information we know, they were seated in the more inside areas, and airflow might be the factor causing the transmission. And we believe there could be a super spreader, but we might not be able to identify who that person is. As for Jade Garden, the outbreak was not large scale. We identified 4 cases so far. we issued a compulsory testing notice for that restaurant because on June the 24th, we found that 2 cases visited that restaurant on the 19th. So it was during their infectious period. The first case was a 68-year-old female. She lived in Qinghe Estate. She visited this restaurant in Tuen Mun on June the 16th, and on June the 20th, she started having symptoms, and the RT result on the 21st was positive. So of the 6 cases from the June 19th cluster, this was the first case. Another case was a family member of this case. For the other 4 cases, like we said, there were 3 patrons across 2 tables plus 1 waiter. And we are still finding out the positions of their tables. One could not really remember. We would find out whether they were seated close to each other. The FEHD would look at the ventilation equipment of this restaurant to see if there were issues. We issued a CTN on the 24th. So through the vaccine pass, we would follow up on the conditions of different diners. We did not identify further cases so far. Finally, for the case was a 57-year-old female. She did wear a face mask during work, and she mainly worked in the kitchen. She helped handle food. So she mainly worked in the kitchen, and sometimes she would carry out cleaning duties. She had her face mask on at all times during work, and she had no contact with residents who went to the day activity center. And she might come into close contact with other staff working in the kitchen. And she could also come into contact with other staff of the facility. We are finding out if there are other staff members who were considered close contacts. She indicated that she dined alone in an activity home with the partitions. So apparently there were no close contacts. But to play safe, since it was a daycare center that elderly people would visit, we asked this daycare center to suspend operation and all staff members to take PCR tests in order to see whether there are further tests, and we also ordered a disinfection.
We have noticed FEHD. As far as I know, staff from the department is doing follow-up action. Lady at the back. Next one. From LTHK. Dr. Ao, yesterday you said that you hope that the Victoria Harbour restaurant can, with the help of a CDD, improve the air change system, but the restaurant is still operating this morning. So is there inadequate communication between it and the department? When there's a cluster at the restaurant, we would, together with government departments, carry out an investigation. Our usual advice is for the restaurant to have complete, thorough disinfection and cleaning, and all staff must go for testing, and would also follow up on the customers on the days when the cluster happened. And the latest incident back on Friday, together with FEHD, we carried out an investigation, examined the place, and a report was obtained yesterday, and we found that there was inadequacy with his air change system. And together with FEHD and CDD, we will maintain close contact to ensure that the air change system at the restaurant is improved before it can reopen for business. Next one, please. I'm from HKO1. About the situation at Changi Go, and you said that indoor dining is banned there, but has there been any lack of or miscommunication there? And also, can the Department of Health give us the latest data on cases discovered on the 6th and the 7th day? Are you worried that there could be a serious inflow of subvariants of the virus into Hong Kong? And also, people who have complied with the requirement for vaccine pass, would they need to acquire new shots? For the Victoria Harbour restaurant in Tuen Mun, we know that the CDD has carried out inspections, and the issue with the restaurant mainly lies with its inadequate change of fresh air on an hourly basis. Under 159F and CAP 132 have laid down the requirements, and together we would follow up on the situation with FVHD. I believe that the FVHD would require the restaurant to improve its ventilation system first, and following inspection by the CTD to ensure that it complies with the standards before the restaurant would be allowed to reopen. And that's our usual approach. And as for arrangement for inbound travelers in terms of quarantine, inbound travelers, tourists right now have to stay in the hotel for 7 days for quarantine purpose. And Hong Kong has an interdepartmental small group to review the number of imported cases to see whether there's any need to adjust the period of quarantine or change the current arrangements. At this day, we haven't got any latest information on any change. So far, the imported cases, most of them were actually identified either on arrival at the airport or within 7 days. And many actually were identified during the quarantine period at a hotel. On the 5th day, there's a PCR test, and PCR test is more sensitive, so quite a number of cases were identified on the 5th day as a result of PCR test. For those cases, we will find out what its CT value is. Some could be positive cases, while others might be were discovered as a result of PCR test. For the latest generation of virus, so far the government has not received any application for recognition of the latest version of virus. AM 730, follow up on your question on the cases, or what the percentage of cases discovered on the 6th or 7th day of quarantine. And also you mentioned about a death case from a care home under quarantine. Which care home is it? And also you mentioned a case in Mount On Shan where a family member was also infected. Is that BA.4 or 0.5 variant? And also in Hong Kong, of all the cases confirmed to BA.4 or 5, are they all minor cases with minor symptoms? And also we said that in the Victoria Harbour case, does the CETD have direct authority to ask restaurants who fail to comply with requirements to suspend its operations, or can the Department of Health use the relevant law or piece of legislation like 599F to instruct the restaurant to close temporarily? As for imported cases and the percentage you asked for, I don't have the exact figure on how many were identified on the 6th or 7th day, but more than 90% of the cases were identified within the 7th day of quarantine, the 7-day period of quarantine, and some of them were identified on arrival at the airport. During the quarantine period, every day the travelers concerned need to do RAT on a daily basis. On the 3rd and the 5th day, the inbound travelers also need to carry a PCR test. So quite many more cases tend to be discovered on the 5th day as a result of PCR tests, because PCR tests compared to RAT are more sensitive. And your second question about the case in Mount Shan, the family member of the case is infected, and we would carry out a genome sequencing for the family member to see if it's a case of BA.4 or BA.5 BA.5. Since they are family members related, so their source should be the same because they're epidemiologically linked. And BA.4, BA.5 cases, most of them are imported. And we also found lately about local cases of that variant. But we can see that for these cases, even though their number are relatively small, but in terms of severity or chances or risk of death of these cases, actually in comparison to other Omicron variants, there's no obvious difference between them. And we haven't seen any death cases which are of the BA.4 or BA.5 variant. According to World Health Organization, BA.4 or BA.5 globally so far, there's no evidence showing that this variant will lead to severe symptoms or higher risk of hospitalization or death compared to other variants. But for BA.4, BA.5, they could be, compared to BA.1, BA.2, more contagious. So therefore, that's an area of concern to us. Your last question about suspension of business at restaurants. Well, normally restaurants are given the licenses by FEHD, and one licensing condition is that they need to comply with regulations on supply of fresh air and ventilation. So whether they should suspend operations or not, or whether there are penalties imposed, it is the responsibility of FEHT to enforce the law. Should there be a cluster, then the Department of Health would intervene and carry out investigation. And together with CEDD, we would carry out joint investigation. And we would let the Department of Health of the result of the investigation to let them take for appropriate action. If in the premises there is a cluster, and if we found a premises is infected, we can under Cap 599A, under that piece of law, Department of Health is empowered to ask the infected premises to be closed temporarily.
對唔住，我手頭冇呢個資料。
I have no information on hand. Final question, the gentleman over there. Good afternoon, this is Ming Pao. In terms of the suspension of premises, we made an inquiry to the FEHD. They answered orally that this decision is to be made by the CHP, so who is the responsible department. Is suspension of business a statutory requirement or a recommendation? Would there be any consequences if they do not comply with the instruction? Even though the EMSD said that the fresh air change rate is insufficient, does it mean that Victoria Harbour Restaurant is operating in contrary to the requirements? The fresh air change is still insufficient. So what is your assessment on the infection risks, and would there be legal repercussions? The Macau epidemic control mechanism made adjustments to the quarantine period of inbound travelers. Does it show a difference in strategy between the two places? Would Hong Kong follow the guidelines by adjusting the arrangements for inbound travelers? What is the CHP's assessment of the risks? For BA.4 and .5, there were 2 untraceable cases yesterday. I'd like to know about the progress of investigation. One of the patients lived in a hotel. So why did he or she stay in the hotel? Both cases went to a school. So what are the infection risks at that school, and would there be follow-up action? In terms of the suspension of operation for restaurants, if there are outbreaks at restaurants, we will carry out investigations with the relevant departments, and we would recommend suspension from business. In earlier outbreaks, restaurants were all cooperative. We will certainly maintain communication with the FEHD, since they hold the power to provide oversight and license restaurants. So for premises affected by COVID-19, under the laws, we have the power to classify such premises as a specified place to be suspended. Earlier this year, when there were outbreaks among the hamsters clusters, some pet shops were ordered to close. For restaurants, we will maintain with the relevant departments according to the established procedures. Victoria Harbour Restaurant opened briefly yesterday. We asked the restaurant to provide vaccine pass information of their patrons who went yesterday morning, and we would see whether any of them were subsequently infected. I have no information on the policy for inbound travelers on the mainland. Normally, in Hong Kong, the government would carry out risk assessments based on the local and overseas data, and in drawing up a policy for inbound travelers. For BA.4 cases, for the 4 cases yesterday, we have not identified the sources of infection yet. We arranged for their close contacts, including family members, to be quarantined. For restaurants they visited during the infectious period, they were included in a compulsory testing notice. We did not identify new cases so far. For the schools they studied in, we did not see related cases. As for the case yesterday who stayed in Harbour Plaza Resort City, he stayed alone in Hong Kong while his family was in the mainland. So apart from going to school, he mainly stayed in hotel. This is the end of the press briefing. Thank you.
We have liaised with the Food and Environmental Hygiene Department to follow up the situation.
We made a recommendation. This is the end of the press briefing. Thank you.